did. It hit me as I'm walking back. Well, you know, I think health insurance like always like up and running like.
Okay. Hey. Oh, Julie. I have to go live.
Yes.
What was that?
What?
Do I not?
What?
Say hi to the people.
Hi everyone. I have to get some stuff
65 likes.
Okay.
I've got.
Sorry, my hair doesn't look so good.
Do we look like twins or not?
Look like
yes,
twins.
we do.
We do not look like twins.
Mother daughter.
No.
Emma gave me her
I
work
am
number.
old enough to be your.
She just wasn't blessed.
Okay, so kind of excited. I got a
175
call
likes.
from UHC that said, could you email us the clinicals on a patient that now we have faxed and uploaded the clinicals 4 times and now they need them by email. So you might be getting somewhere
238
with United Health Cartel. So what else are we doing here?
Well, so my yarn got misconstrued as a tobacco product, so I tried to appeal it. It was yarn. I can pull it up to show. It was green yarn, and somebody said I was selling tobacco products.
Well,
I wasn't.
Missouri is a recreational marijuana state, and we are allies here, so let's not judge.
But it wasn't. It was literally yarn.
Well,
I swear on it.
It doesn't much matter.
Hi, Cam. We're at 238 likes. 3 people are watching.
All right. So, does anyone have any questions that we can help with?
Meridian.
Oh, Meridian.
Oh.
No, Meritane. Meritane is an insurance company. Meridian is something else.
Meridian, someone asked about for health insurance, and then someone also said that doctors are the reason that health prices are so expensive. And I commented back that they only get 27% of your entire medical spend, which is 27 cents to the dollar. But could you explain a little more how the
We serve the working class folks here in Bridgeton, Missouri. We are paid a percentage of Medicare allowable. And for every year for the past at least decade, Medicare allowable percentage has dropped, which is insane because everyone knows that all of our costs have skyrocketed. Our staff costs, our supply costs, even sodas. I mean, we supply sodas to the staff and all of our patients, and it's $7 for a 12-pack of Diet Coke. So everything is expensive, and in fact we're getting a pay cut. Independent physicians are getting another pay cut for Medicare on January 1st of 2024 of another 3.5%. So how this works is you have your commercial payers, your commercial insurance companies, your United Healthcare, your Aetnas, your Anthems, and they pay us a percentage of Medicare allowable. So sometimes it's not even 100% of Medicare allowable.
So that would mean
a little bit more.
Their salaries actually going down. They're not getting raises.
Physicians' salaries are going down. That's absolutely the case. And so one of the dilemmas that you have is you have Dr. Bach, who's 63 years old and has been a rheumatologist practicing since 1994, which is kind of a long time.
Wasn't born yet.
And, you know, at a certain point, he's going to be like, God, do I need to deal with all of these administrative burdens and reduction in income at this age? Or should I just soap up the windows and close the practice and say, you know what, I give up? But you know what? He's not giving up because he loves what he does.
Yeah.
He is a born healer, and so he loves coming to work every day. Therefore, we support him doing that. And in order to support him, that's why I have to have 24 staff people to take the administrative burdens off my one physician.
What's the hardest part about being a practice manager?
About being a practice manager is definitely tangling with the pharmacy benefit managers and the insurance companies. If we could just go back to, 10, 12 years ago when a physician's prescription, that was his or her prior authorization. And there's clinical reasons why doctors pick certain medicines for individual patients. Nobody is one size fits all. They're not even one size fits most. Everything in rheumatology has to be prior authorized because of the expensive drugs we prescribe. So it's just hard. It's hard, and the prior authorizations are just burdens and stepping through broken glass trying to care for patients.
Do you think they benefit the patient in any way?
Absolutely not. Absolutely not.
What are insurance, what is their whole role? Why do we have insurance?
We originally had insurance because they were sort of an offshoot of pharmaceutical companies, right? So I would love to go back to the days where you went to a doctor and you gave them a chicken for taking care of you. I would be so down with that.
You'd have too many chickens.
Well, I'm okay. Then I would take the chickens I need and then give the chickens to my patients or
that's
whatever.
lovely.
All we need to do is
come on in, Maya.
Just
know where this goes.
This is Maya.
right
She
here.
is our infusion medical assistant. Say hi to the crowd.
Oh my God! And she's
she's breaking
I'm
stuff.
bringing them a fan.
Yes. So we had a big dust up today in the infusion room.
What's a
because,
dust up?
A dust up is when things go backwards. But Maya and our infusion RNs hauled all the infusion patients outside with their IV poles because there was natural gas being pumped into the building from some stupid thing going on with the building on the roof. Thanks, Maya. But it wasn't like a danger. We had the gas company out here and everything, but everyone was just getting headaches. So
I breathed it the whole time.
yes. So anyway.
He was actually, the Spire guy was a cancer survivor, and he said, I know how these patients feel because when you're on that chemo, you feel, and you smell that, it'll make you sick. So he's
Yes.
like, we got to make sure they don't feel that way. So you don't know who you're going to meet.
Right. So so we got that dust up resolved, but we had a bunch of fans running in the infusion room to just kind of clear out all of that stuff. I have still a little bitty teensy headache from the whole gas leak.
Do you think with these drug manufacturer insurance plans that are coming out that things will change better for the patient, or is it just going to be another barrier?
Probably just another barrier. I mean, look, insurance companies are middlemen doing none of the actual healthcare and making all of the money, and just serve as delay and denial tactics. Insurance companies answer to shareholders. I answer to patients. My whole team answers to patients. So we do right by our patients. The customer of mine is the patient and the referring physician. The customer of the insurance company is the employer's HR department and CFOs, and they're all on the take. So I don't anticipate traditional insurance changing in a positive way ever.
I do. We're
Okay,
gonna change it.
She's young and she's got energy.
We're gonna change it. Direct
I'm
care.
58. I can only do this one patient at a time.
I can do it 20.
Okay, so I worry about my children's children that don't exist yet, but there are some glimmers of hope with Free Market Medical Association and with direct care, that employers pay the physicians and the pharmacists doing the actual work directly and cut out the insurance companies and certainly those rotten pharmacy benefit managers.
Which, can you even imagine how amazing that would be? The medical debt, 1/4 of Americans that are filing for bankruptcy because of medical debt, you just pay in full. I would save money. We're doing a test trial on one of my coworkers, Kristen. She just canceled her insurance.
She did?
Yep.
Oh, that's right.
She did.
Yeah.
So she is my spokesperson for it, and we're gonna see what we can get her into. Drug coverage is the hardest thing in hospital.
Well, the thing is, if you get hit by a bus, you can actually benefit from having insurance because they're going to probably take care of it. However, my friend, her husband got COVID in 2020, and there was no hospital bed for her husband. And this was in 2020. It's almost 2024, and her insurance company at the time, Cigna. Yep, I said it. They denied his entire hospital stay, saying he didn't go to an in-network hospital. I'm still helping her fight this claim. It really sucks. I mean, Cigna and all these insurance companies are multi-billion-dollar international companies, and you pay the premiums, I pay the premiums, everyone's a patient, and everyone gets denied services, and we still end up paying. So, it's all a jam job, and I want to get back to physicians caring for patients and not dealing with these administrative prior auths and denials.
That's literally her entire day. We are here.
100%.
She gets here at 8 a.m. except for on Wednesdays. The entire day, I sit there and I'm like, because she's on the phone with insurance companies, and she's like, do any of you actually want to help my patient, or are we just going to keep circling the drain? That's another one I got from her. If you hear me talk long enough, we sound the exact same. But the only way we've gotten things through is by educating you guys, and you guys throwing up your hands and saying what the hell's going on. And now we have insurance companies calling us asking, give us a little, let us fix it. So, I mean, if just this little TikTok can do that, how can we not change the world?
We do need to change the world. So I'm still working on my PepsiCo case. Right this second, it's still Pepsi no, but
She'll always be a Coke girl.
I really will, a Diet Coke girl. However, I will drink a Diet Pepsi on TikTok. I will chug a Diet Pepsi if these morons give me a pass to care for my patients.
You should. What is it whenever you shotgun? She'll shotgun a Pepsi.
I'm too old for that.
I can't either. It'd come out my nose. That's why she's gonna do it. And if we get to 10,000 followers, she'll shotgun a Pepsi if we've gotten everything figured out. Otherwise, I'm gonna put a pie in her face.
You're not putting a pie in my face. You're not putting a pie in my face. All right.
I have to let her go back to work.
Yes.
Let's go.
Bye, everyone. Fiddlesticks, fiddlesticks, fiddlesticks.
That means the F word.
No, it doesn't.
It does.
No, it doesn't.
Okay, we are walking through, and we are going back to, oh, she's not even in here. So, anyone have questions? What's up? It's not me. No, I'm just gonna find Kristen.
Oh, okay.
Hey, how are you?
I'm good. How are you?
Staying out of trouble?
Never.
I didn't think so. Oh.
Hey, Kevin, how are you?
That's my buddy.
Hey, Dr. Mac, how you doing? Christian, table for one.
Table for two. Oh, I didn't get that joke. Fudge. Word vomit.
Well, I also scooted our stuff.
Hey, Dr. Bach,
Yes, ma'am.
will you make a guest appearance? Say hello. This is the man.
Hey, Dr. Bach here. How are y'all today? We're having a busy day like we always do. Had a new doctor in today that might work with us one of these days. Kind of excited by that. It's always fun to hear.
Look, who wouldn't love to be treated by this man? He's the best. And that's how we run a good office, is by having the best doctors.
The hole is on the bottom.
All right, bye.